This segment is designed just to assess your understanding of the previous presentation on Graves' disease. Take a deep breath, focus your mind, and let's begin. Question 1. A client with newly diagnosed Graves' disease reports new onset chest pain palpitations and shortness of breath. Which action is the nurse's priority? A, check thyroid stimulating hormone level. B, place the client on a cardiac monitor. C, notify the provider about possible dose adjustment. D, encourage slow deep breathing. The correct answer is B. Because chest pain and palpitations in hyperthyroidism signal dangerous tachyarrhythmias and possible progression to thyroid storm and must be monitored immediately. A is important but not urgent for safety. C is secondary after stabilization. D is supportive but does not address the physiologic danger. Question 2. A client on methimazole states, "I feel extremely tired and noticed yellowing of my eyes." What is the most appropriate response? A, reassure this is expected. B, instruct the client to stop methimazole and obtain liver tests. C, tell the client to increase fluids. D, advise taking methimazole with food. The correct answer is B. Because methimazole can cause hepatotoxicity and jaundice is an emergency indicator. A is unsafe. C and D do not treat the underlying pathology. Question 3. A client with Graves' disease receiving radioactive iodine therapy asks when improvement will occur. A, in 48 hours. B, within 1 week. C, in several weeks as hormone stores decline. D, immediately after treatment. The correct answer is C, because radioactive iodine works gradually as thyroid hormone stores deplete over weeks. All other answers imply unrealistic or dangerous expectations. Question 4. A client with severe exophthalmos reports inability to close eyelids fully at night. What is the nurse's best action? A, apply warm compresses. B, tape eyelids gently at night and provide lubricating drops. C, encourage fluid restriction. D, assess for bowel changes. The correct answer is B. Because exposure keratopathy is a serious risk in Graves' ophthalmopathy and eye protection is the priority. Warm compresses do not prevent corneal damage. Fluid restriction and bowel assessment are unrelated. Question 5. A pregnant client in the first trimester has uncontrolled Graves' disease. Which medication is preferred? A, methimazole. B, propranolol only. C, propylthiouracil. D, discontinue all medications until the second trimester. The correct answer is C, because propylthiouracil is preferred in the first trimester to reduce teratogenic risk from methimazole. Propranolol alone does not treat the disease. Stopping therapy is dangerous for both mother and fetus. Question 6. A client treated for Graves' disease arrives with fever, 103 severe tachycardia, agitation, vomiting, and confusion. Which intervention is priority? A, administer acetaminophen. B, check glucose. C, start beta-blocker steroids and antithyroid therapy per emergency protocol. D, place warm blankets. The correct answer is C, because these symptoms indicate thyroid storm requiring immediate multimodal therapy to block hormone synthesis conversion and adrenergic effects. A and B are supportive but not stabilizing. D, worsens hyperthermia. Question 7. A client on long-term antithyroid treatment suddenly reports sore throat and mouth ulcers. What is the nurse's first instruction? A, take the next dose with food. B, stop medication immediately and seek evaluation for possible agranulocytosis. C, drink warm liquids. D, schedule routine labs next week. The correct answer is B, because fever and ulcers indicate potentially life-threatening agranulocytosis requiring immediate evaluation. All other actions delay needed intervention. Question 8. A client recovering from total thyroidectomy reports tingling around the mouth and fingers. What should the nurse do first? A, reassure this is normal post-operative discomfort. B, check the calcium level and assess for Kovacsak's sign. C, encourage ambulation. D, offer analgesics. The correct answer is B, because tingling suggests hypocalcemia from parathyroid injury, which can progress to laryngospasm and airway compromise. This assessment guides urgent replacement therapy. Reassurance is unsafe, and ambulation or analgesics do nothing for calcium deficit. Question 9. A client asks why the provider insists on avoiding pseudoephedrine while treating hyperthyroidism. What is the best explanation? A. It interferes with thyroid labs. B. It suppresses the immune system. C. It increases sympathetic stimulation, worsening tachycardia and the risk of arrhythmias. D. It decreases absorption of antithyroid drugs. The correct answer is C, because pseudoephedrine is a sympathomimetic that significantly increases heart rate, blood pressure, and adrenergic drive, creating immediate danger in Graves' disease. These challenging scenarios sharpen pattern recognition for what truly matters. Thank you, and see you soon.